Mike Moore Media.
I'm talking with Trey Wright, Rockingham County Department of Health and Human Services, Public Health Director here in our county. Trey, how are you? Good to have you on the program.
Good. Great. Happy to be here today.
Well, I know we're talking about the MOUD program and substance abuse and things like that. So first, tell us, what is MOUD?
MOUD is an acronym that we use. It's for Medication for Opioid Use Disorder, and with that, it's a clinic that we're hoping to start here very soon in our public health department to provide Suboxone and counseling or behavioral therapy for individuals that want to come to our clinic to maybe get off of opioids or try to treat their addiction and make them a better or more productive citizen here in the county.
So I've read a little bit about this, Trey. So this is the wording I kept seeing was this is a whole patient approach, it sounds like.
Yes, we're really excited about that here since we do provide adult primary care services, and we do try to target our uninsured or underinsured population. So an individual that can come here for those substance abuse counseling treatment services, as well as our adult primary care. And also, our dental that we see adults here in our facility as well.
Mm-hmm. Yeah. Well, there's so many good things happening in public health here in Rockingham County, and I hope people will go to your Facebook page or your website, rockinghamcountync.gov, click on the departments there up in the, I think, top left, Health and Human Services. And when I was looking at that earlier, you are providing so many services for our citizens, but the new program you're talking about here for opioid use disorders, very important because substance abuse continues to be a very serious problem everywhere, but here in our county as well.
Yes, we were very excited that the Board of Commissioners approved us using some of the opioid settlement funds that had came to the counties and states here in the United States to combat this epidemic. We were very fortunate and had looked at other counties that are providing similar services. Surrey County is doing something very similar, Granville and Vance counties, as well as a very small county way out west in Madison County, right there at the Tennessee border. So we were very excited to look at others and try to replicate and improve on certain things that we knew can hopefully match our community's needs.
Yeah, okay. And I know before we started the program, I hear this also referred to as MAT, medical assisted treatment, but same as MOUD.
Yes, depending on the clinic setting, it might be interchangeable depending on where you're at. For example, you might hear it called MAT that may be provided in the jails. A lot of counties in North Carolina are starting to do that. Mm-hmm. So we typically just call it MOUD here in our public health clinic. Okay.
Tell us how this program works.
So our first year, so we'll call it our pilot year, we're targeting at least 30 patients. We want to see at least 15 uninsured, and we're going to set aside a pot of funding to make sure that they receive services regardless of ability or inability to pay, and also those that may have insurance or Medicaid as well. But we are hoping to receive referrals. Here in Rockingham County, there are very few agencies that offer these services, and there had been in the past year one or two that had actually closed. So we know there is a good number of about 150 patients that needed these services, so we're hoping to see referrals from those former agencies or word of mouth. And also, too, our integrated health community paramedicine program here with our human services received a grant to start a bridge MOUD program. So when they go to an overdose call, and if the individual agrees to it, they can administer MAT for 7 days. So we hope to have that warm handoff from integrated health to us or to another agency such as Daymart to provide these services.
I understand that there are just a select group, maybe 3 FDA-approved drugs for this program, too. Is that correct?
Yep. There is, without me looking, there's Suboxone, which is a combination of naloxone and buprenorphine. There's buprenorphine and methadone.
Mm-hmm. Okay. So the treatment really is combination with what you're talking about here in counseling, behavioral therapy. It's just a kind of a combination of things working together, it sounds like.
Yes, outside of the medication treatment side, there is the counseling services that we're working on as well. We're working to get our job descriptions fine-tuned and recruit a counselor, so a licensed clinical social worker that can do some of these cognitive behavioral therapies with the individual, because treatment alone is just not enough. We want to make sure that we work with this person on their mental health, on their physical health, so they live a road to recovery and hopefully a lifelong road to recovery.
Yeah, okay. How serious is, we hear about the opioid epidemic all the time. How serious is that here in Rockingham County, substance abuse, Trey?
It is a very serious problem. We have access to our emergency services data where we're seeing they're running overdose calls, and what's very concerning, it's concerning enough, the overdose calls, but individuals do not want to go to the emergency department for services afterwards. They may be revived, but they're refusing services. So you're seeing less emergency department visits for overdose, but more calls. So we're seeing more and more of those folks refuse any more services. So we know we need to treat them where they're at the home. When someone is overdosed, we have a 24, 48-hour window that this is when they might say, I want to change my life. So it's very important that we can get to them right away.
Why would some, just curious, what are some of the reasons people did not want to continue that treatment? I mean, go any further with that once that happens?
Well, when someone is revived from an overdose, they can be very combative, very confused. And addiction is a very difficult thing to habit to break. There's such a stronghold in your mind on these substances that they may not want to break that right away. And also there's fear of the cost of emergency department visits. And, again, during the overdose and revival, there's a lot of confusing things, combative that can happen.
Yeah. Okay. What ages are we talking about here in Rockingham County?
For the MOUD program, we are at first going to target our adult age population. So that's typically going to be 18 and older, maybe 16 with consent. For this, since this will be our first year of the pilot, to kind of iron out how the clinic flow and how this patient load will work for our providers.
Mm-hmm. Okay. So this is starting in the new year. So tell us what do we have an actual time frame on that when this is cranking up?
Not yet. This past week, I finished working on our job descriptions where we already have here in the county counselors in other departments. So I had to take that job description and kind of tweak it to what's needed for us for substance abuse treatment and counseling, as well as a provider. So we're hoping to, in the next several weeks, go ahead and post our providers. So that might be a nurse practitioner or a physician's assistant and a counselor. So we're looking hopefully for a LCSW for those two positions so we can recruit them and get everything in here and hopefully start seeing patients right away. Yeah,
okay. You have a large department because there's so many services that you provide for our residents here in the county. How many, is there a ballpark figure, actual number that maybe you could share with us about how many on your staff?
Any given day, including our mobile dental unit that's, of course, in the schools, we have about 74 staff members in this department.
Yeah, okay. Let's talk, you just mentioned that, I want to talk about the mobile dental unit in a moment before we finish up, but is there anything else you need to tell us about this new MOUD program?
We're very excited, and the most important thing is with the mission here of our department is really to collaborate with our community and provide the quality services that are needed to promote the health, safety, and well-being of our community, and provide education, care, and advocacy when needed. We're in the business of helping people, so we try to do that as much as we can. And if and when we expand services, it's not just for giggles. It's because it's needed. We talked about it. There was maybe only 2 agencies providing this service in the county when 150 people just lost this service. There was a need there, and we hope whenever things happen like that, public health will step up.
Sure.
We're going to so long as I'm here.
Yeah, I understand. And we appreciate that, seeing the need and meeting it and making it happen. So thank you for that, you and your team. Let's talk about, I've been hearing good things about that mobile dental lab. That's out there rolling and doing some good things.
Oh, yeah, the mobile dental unit, we're on our second school now. We started as a soft opening before we had the thing wrapped, and quote, floss cutting instead of ribbon cutting in October.
Right, yeah.
We started with Dillard as they are a year-round school, so it gave us some time for them to go ahead and have started their school year and get in and kind of do a quick run-through of what worked well, what did not, how's the systems working, do we need to upgrade computers, how is our internet strength and signal, and we did our official launch on October 30th over at Mall Street.
Mm-hmm. Yeah, well, that's just one of the many services that our health department here provides, so thank you for that. Before our time completely gets away, is there anything else, maybe we've got a couple of minutes here, Trey, that you wanted to mention?
We always say we are the county's health department. We provide services to everyone regardless of ability to pay and depending on their insurance carrier. We are here for your flu shots, your COVID vaccines, you name it. So we are here for the community. Anytime someone does not feel well, you can call us and we will try to get you scheduled. That is what we're here for, and that is we are the public health department, so we try to make sure we care for everyone.
Thank you for that. The best number to call to get to you?
To me, that.
Well, to the health department. Is it 342-8140?
Yes, I was about to say I don't know my own phone number right off bat, but yes, that number you said is correct.
We'll go with that one then. 336-342-8140 for the Rockingham County Health Department. Trey, it's great to talk to you. Good luck for helping so many people here as you get started in that new program in the new year. And thank you for you and your health department team for all of the services that you provide in Rockingham County. Again, I want to invite people to go to the county website, rockinghamcountync.gov. That's a great tool, good resources there. Click on departments, scroll down to health and human services. And my goodness, I'm so impressed when I look at that. Trey, thank you very much. I hope we can talk more in the new year.
All right. Well, thank you so much. And if I don't hear from you again, I want you to have a wonderful Christmas.
All the best to you. Thanks a lot. I appreciate your time.
You.
Okay, bye.
Right, thank you. Bye-bye.
Talking today to Trey Wright, Rockingham County Department of Health and Human Services, our public health director here in the county. Again, that phone number to the department is 336-342-8140. You'll be reading about, hearing more about the MOUD, the MAT program for opioid use disorders, a substance abuse program that's starting in the new year here in Rockingham County.